There were soldiers that I helped in Kuwait, there were soldiers that I helped in Iraq, that we helped make safe or get to a safe place. And I think having had those experiences of helping those people get safe or to be safe in a battlefield or in a dangerous situation was really rewarding. You see the effects of what you do when they go home. For me, psychology is the love of understanding the human condition and understanding what are the components that make people who they are, what they are, and what they do. I think the key that I focus on when I'm working with patients or with soldiers or in the past would be to try and always see and work with issues and items from the patient's perspective or from the soldier's perspective, right? Understanding where they're coming from is the first step in really being able to help them change their behavior or how they see things. You know, one of the things that they tell you in the Army is hurry up and wait. And so you learn to get good at that. And in transplant, when there's a waiting list, it's really hard to accomplish that goal of do everything you have to do and then wait. But at the same time, at the end of the wait comes something good. And so I think that that's an important skill to learn how to do. You know, transplant patients are a challenging group, but they're actually one of the greatest populations to work with because they get better so quickly, right? So we help a lot of people here to improve physically. When you put in a fully functioning new organ to that person, all of a sudden there's a rapid change, and oftentimes people have difficulty adjusting to those changes or trying to make it with the new organ because of all the different things that are involved in terms of medication and doctor's visits and dietary changes. And so interacting or helping people make that change sort of gets at that combination of understanding where somebody is and then helping them see the next stage in their life as well. You know, we're doing some exciting things with Transplant here, and the incorporation of a psychologist into the Transplant team. I can help explain to surgeons and physicians and other team members what it is that might be driving somebody's behavior, or what it is that's contributing to their difficulty taking medications, or what it is that is making their family relationships difficult or contributing to their illness in some way. It allows us to do a better job of taking care of the whole person. You know, in terms of behavioral health, especially in the veteran community, oftentimes there's a stigma associated with having problems or having difficulty adjusting or having difficulty with depression or anxiety or any number of symptoms. And for people that are in that situation that are having difficulty, I want to reinforce the message that help is available, services are there, and you can lead a better life. You can experience improvement in depression, in anxiety, in PTSD, in those symptoms or problems that you're experiencing. It's an honor to work with patients. It's an honor to work with soldiers. Watching people get better is a really rewarding thing to do. And the fact that VCU lets me do it and the fact that the Army let me do it, I'm really grateful.